Yeah, I would like to welcome you, and we're just going to start the recording here. So welcome, everyone. My name is Joel Miner, and I am the manager of the Environmental Justice Unit at the Colorado Department of Public Health and the Environment, or CDPHE. We are very excited to have you all participating in this meeting this evening about EnviroScreen. In just a moment, I will turn it over to our interpreter for the evening, Lynette Garcia, to give a quick statement on language justice and instructions for the Zoom, but I will just quickly say that all in Spanish in the interest of language justice. Así, bienvenidos a todos. Me llamo Joel Minor y soy el gerente de la Programa de Justicia Ambiental con el Departamento de Salud Pública y Ambiental de Colorado. Gracias por su participación en nuestra reunión pública sobre Colorado EnviroScreen esta noche. Y ahora, Lynette.
Muchas gracias, Joel. Thank you so much, Joel. Hi, everyone. My name is Lynette Garcia, and I'm here with the Community Language Co-op. And I want to thank the organizers of this space for practicing language justice. What that means is that we are creating a space where everyone can participate and engage in the language of their heart, right? So you can choose whatever language you feel most comfortable in. We will be using simultaneous interpretation. As soon as I finish my statement in Spanish, we will be turning that on. There's going to be a small globe at the bottom of your screen where it says interpretation. However, if you're on a tablet, if you're on a phone, there's 3 little dots to the right on your screen that says more. And you can choose that language of your heart there. However, if you're fully bilingual, feel free to listen to a language of either or you can go ahead and just mute interpretation completely. Hola, me llamo Lynette García y estoy aquí con la cooperativa de lenguaje en la comunidad. Quiero agradecer a los organizadores de este espacio por practicar la justicia del lenguaje. Eso significa que los organizadores de este espacio quieren crear un espacio donde todo el mundo pueda practicar el lenguaje de su corazón, ¿verdad? Entonces, utilizaremos la interpretación simultánea y lo que significa es que abajo, en su pantalla, está en una computadora, va a haber un globo y ahí pueden seleccionarlo y ahí dice interpretación. Y ahí pueden escoger el lenguaje de su corazón. Pero si están en un celular o en una tableta, van a ver 3 puntitos a la derecha donde dicen more, más. Y ahí puedes seleccionar ese lenguaje. Y creo que es todo. O sea, si son completamente bilingües, no tienen que escoger un lenguaje, pero también pueden silenciar completamente el audio si prefieren. Let's go ahead and turn on interpretation to make sure that it's on. Vamos a aprender la interpretación. Muchas gracias. Thank you so much. We will make a quick check to make sure it's working. Vamos a tratar de revisarlo para ver si está trabajando.
Thank you, Lynette. If you have questions about the translation, please feel free to ask in the chat or to speak up now if you're having trouble finding the language of your choice. All right, go ahead and continue to, hopefully everyone is set up. We're going to take a moment to do quick introductions for the project team. Joel, thank you for the welcome and the introduction earlier. My name is Josie Plout, and I am the facilitator for this meeting and leading the public engagement work for the development of the EnviroScreen tool, which we will talk more about when we get started. In addition, I would like to go ahead and introduce the rest of the CDPHE team. Natalie, could you start?
Hi, good evening, everyone. My name is Natalie Eddy. I'm the Air Quality Liaison for the Environmental Justice Unit with CDPHE, working with Joel Miner. Thank you for joining us.
Thanks, Natalie. And Lauren?
Hi, everyone. I'm Lauren McDonnell. I'm the Outreach Planner for the Climate Change Unit at the Colorado Department of Public Health and Environment. Great to see you all.
Thank you, Lauren. Margaret?
Hi, everyone. My name is Margaret. And I am an environmental epidemiologist with the Colorado Public Health Department. Thanks.
Thank you, Margaret. And we'll introduce the CSU team, David.
Hello, everyone. I'm David Rojas. I'm an assistant professor in environmental epidemiology at Colorado State University. I'm helping to the development and the methodology of this tool. Welcome, everyone.
Thank you, David. And Dan.
Hello, Dan Carver with Colorado State University Geospatial Centroid. I'm leading the technical development of the web mapping application itself.
Thank you, Dan. And is there anyone else from the team? Sorry, I'm so sorry. Let's do the students. Emilia.
Hi everyone, my name is Emilia. I'm a student at CSU and I also work in at IBE. So I'm going to be monitoring the chat today.
Thanks, Emilia. And I believe if you are not already, you will probably go to the Spanish language room if I'm not mistaken. Or I guess you're bilingual, so you can do anything. Lucky you. And Lindsay.
Hello, everyone. My name is Lindsay Garcher. I'm a student at CSU, and I also work with IBE on the community engagement portion of this project. I'll be taking notes during this meeting.
Thank you, Lindsay. All right, is there anyone that I have missed? And Jen, oh, I'm so sorry.
Hi, I'm Jen. I'm a project manager with CSU's Institute for the Built Environment supporting the community engagement efforts, and I'll be monitoring the chat today.
Thank you so much, Jen. Sorry about that. And have I missed anyone that doesn't have their camera on who's on the project team? All right, well, let's go ahead and get started. Let me share my screen. All right, can I, oh. All right, I can't see you all at the moment. So can someone confirm that you're able to see the screen?
Looks good.
Yes.
All right, great, thank you. All right, so thank you for joining us for the first public meeting about the new Colorado EnviroScreen tool. We've already spoken about language justice. And this is our agenda for this evening, so welcome. Thank you all again for being here. We'll give you a brief overview of the Colorado EnviroScreen tool and its intended use, and then we will engage in a couple of polling questions. So we have a short survey for you all to participate in, and then have an open question and answer period. In addition, we will have a clarifying questions after the initial presentation. So I'll explain those as we go through. So first and foremost, the purpose of the Colorado EnviroScreen tool is to be a resource that helps to address environmental health inequities in Colorado. And we'll go through a little bit more about how EnviroScreen will do that, both in terms of what it will look like, what data will be included, what methodology will be used, and how users like you might be able to engage this in your work. So EnviroScreen will be an interactive map, and it will give a visualization that shows where health, environmental risk, and social inequities overlap across the state of Colorado. So it will be a kind of heat map, if you will, that will visualize data-based methods that help to show us where exactly in the state people are experiencing adverse health impacts due to their environmental risks and resulting social inequities. Sorry, that wasn't quite as clean as it could be, but we'll keep going, and hopefully you'll get an idea, and there will be some time for question and answer if I don't get anything just right. So the goal, first and foremost, is to help users, and we want this to be a tool that is intuitive and accessible by any number of residents and advocates, academics, people across the state who might be working on environmental health inequities. And that is the primary purpose of the tool, is to help identify where there are environmental health inequities across the state. In order to do that, the data must be of very high quality and be reliable and trusted in terms of the sources of data. This is really meant to help empower communities to be able to advocate for themselves, as well as for others to advocate for them, like lawmakers, so that communities are more empowered to be able to state the facts, be able to share relevant information, and help direct attention and resources to resolving environmental health inequities across the state. And by doing so, to advance a more healthy, equitable, and sustainable Colorado. Furthermore, many of you may be aware of the recent Colorado Environmental Justice Act that was passed, and this tool will play a large role in helping CDPHE to support the implementation of that bill. And finally, this tool is intended to replace the existing climate equity data viewer as Colorado's premier environmental justice map. So for those of you who are familiar with the climate equity data viewer, this will be an extension of and an upgrade of that tool, being more comprehensive and more capable than the current climate equity data viewer. So next, we're going to turn it over to David, who is going to talk about and show some examples from other places, other states who have similar tools. David?
Thank you, Josie. So this type of tools already exist, and other states already have this kind of maps that help us to visualize where health inequities, social inequities, and environmental risk are happening geographically. So, and we will present you 3 different examples of those tools. Next. So what you're looking at now on the screen is the example of the Washington State Environmental Health Tool. So the general idea is you have a website with a map of the state, with the subdivisions of the state with different colors. And the colors show the pattern of where the pollution is more common, where the health issues are more common, and also the social inequities happen. So give you a visualization on where these overlaps are present geographically at the state level. Next. Similarly, we have another example here, the New Year's Environmental Justice Mapping Tool. What you see here is a highlight the border of the state and also internally a subdivision of the state with the different colors. The general idea, again, is highlighting where the environmental risks, the health inequities, and the social inequities are happening in a geographical scale. Next. And the final example is here, the tool from California. Again, you see different patterns of color, but you see a map that gives us the distribution or the geographical distribution of those 3 key factors: socioeconomic indicators, health indicators, and environmental pollution. And again, the idea is that we have a map that we have, simple visualization, the highlight or location of where these 3 pillars of health are happening in the same place. Next. So these tools have different kind of information. One of very important part of the information are the environmental exposures. So we have air quality as an example, water quality, different type of indicators that try to describe the presence of a pollutant. Also have some kind of information that provide us where the emissions are happening. So waste management facilities, cleanup sites. In addition to those environmental risk factors, the tool, next, also provide us with information about where the more common diseases are happening at the state level. So give us this geographical pattern of disease that could include respiratory diseases or cardiovascular diseases, in addition to the socioeconomic factors, where poverty could be more common, where indicators of education, housing, employment are also present geographically in the state. Next. The tool actually combines all this information to actually provide a final score that gives us a sense of where these geographical overlaps are present. So probably they will not provide a causality or connect those dots, just provide a visual representation of where these things are happening geographically in the same location. Next.
So the intended use of this tool is to help support both individuals and organizations, anyone who is working to address environmental health inequities in Colorado, and especially for communities who have experienced a disproportionate burden of negative environmental conditions. We'll talk a little bit more about what each of these terms means, particularly around disproportionate burden of environmental health conditions. However, the main point to take away here is that this is intended to be a tool for people to use and to be able to support their work in addressing environmental health inequities. So the intended users may be any variety of people. I won't read each of these, but we do believe that this tool should be useful for community advocates as well as community researchers, members of disproportionately impacted communities, any variety of organizations who are already working towards environmental justice and improving health outcomes for people in Colorado, as well as for academics and researchers who are doing work in this field. In terms of disproportionately impacted communities, it's kind of a mouthful to say, but it really means the communities in Colorado who have experienced unequal health risks due to environmental exposures like pollution, oftentimes from multiple sources. And we'll talk a little bit more about that. But the health risks and the health burdens are not shared equally across their state. Some communities experience unequal health risks in relationship to others. In terms of what we mean to address through this tool, we're talking about the physical environment. So that would include the built environment, pollution, industry, other natural causes such as radiation exposure. Often that results in some industry activity such as mining, but also radon, which is naturally occurring in the earth. So these are the kinds of exposures that we're looking to address. What is not included in the Colorado EnviroScreen tool at this time are factors related to the social environment. So the, perhaps the abuse or support that one receives at home, or to occupational exposures that one receives on the job, issues related to behavioral risk or to unnatural disasters. So really the purpose of this tool is around the environmental exposures and not so much to social exposures or work exposures. When we talk about cumulative health impacts, we're talking about long-term health risks that are posed by present, past, and future exposures to multiple pollutants over time. And that's again usually through multiple pathways such as air, water, and or soil. And that's within a specific geographic context or within a specific geographic area. So again, there are concentrations of multiple environmental exposures that are happening in some communities more than others. And we're looking at the cumulative health effects that has, such as low birth weight, asthma, and similar types of effects, negative health outcomes. So in terms of the development timeline for this tool, we are just wrapping up the initial kickoff and community engagement portion of the work. So we've been conducting interviews and focus groups with likely users, and then we're doing this public meeting as well. Then we're going to go into an intensive period of tool development. So there's a lot of technical aspects that are related to bringing all of this data, to identifying the appropriate and reliable data sources, and creating a visual interface, as well as the methodology behind those visual maps, like the one that David showed you. And then we'll come back in the spring. So you may not hear a lot about this for the next several months, but we plan to come back to this group and to others and engage in some beta testing work. So that's where we will have some initial mock-ups of the tool, and we will be sharing those with intended users and saying, do you like this or do you like that? How is the intuitive use of this tool? What is confusing? What is not confusing? Do you have a visual preference on color? All of those kinds of things is what we'll be doing in the late spring of 2022. And then our intention is to launch the first version of Colorado EnviroScreen in approximately June of next year. So, and then CDPHE will continue to maintain and upgrade this tool going forward. So the first version may not have all of the features and functionality that we'll hope for, but the intention is that this tool will continue to build and be improved upon for years to come, and that this will be the first version to work from. So with that, I think we'd like to see first if you have clarifying questions. The group is small enough this evening that you may choose to either put your questions into the chat. If you know where to find that, you may have a pop-up button. I can also stop the screen share for a moment, and we can take your questions either verbally or in the chat if you'd like to better understand what the tool is, how it will work, who might use it, what factors might be included, and questions of that nature.
We have a question regarding the source of the data for the tool. What is the source or sources?
Great, thank you. David, would you like to start with that?
Yeah, so there are different sources that we use to actually collect data on environment. As example, there are already information or maps that the EPA provide in terms of air pollution. Also the census also give us information about socioeconomic indicators. Health data is data that is provided by the state of Colorado. So we use multiple sources of information, and we tend to use the latest available data. And also, if we have two different sources for the same kind of information, we try to select those that are not only more recent, but have more coverage inside of the state of Colorado.
Would anyone else like to weigh in on that particular question? Looks like we have a number of questions coming in the chat, so excited to see your questions. All right, let's take the next one, Jen.
So this builds on that a little bit in regards to the cumulative health impacts and expanding on how comprehensive the coverage will be and how it will be incorporated into the map.
David, I think that might be for you again.
So if I understood well, the question is the cumulative process.
The cumulative health impact. So kind of expanding on how the various data sources and the cumulative impacts from those will be integrated into the tool, how comprehensive the coverage will be, how it's going to all be integrated into the map itself.
Yeah, so what we are covering with this tool is the long-term impacts of this environmental exposure, or what we can expect as a long-term impacts. So we normally, as example, again, in terms of air pollution, what we are including is the annual average concentration of different pollutants, not the single day or 24 hours or daily concentration of pollution. So we try to cover or collect the information based on long-term exposure, but also health outcomes that probably will reflect that long-term impact. In other terms, like incidence of a disease or probably life expectancy. So those outcomes that we expect that you need to be exposed for several years to actually develop a disease, of several months at least. So the general idea is to combine all this information in individual layers that in a single overlap, we can actually create a score. So the final value that you will see and the final interpretation of the colors will be a score that will tell us where all these information are geographically overlap. That doesn't mean that if we find a place that have more asthma incidents, that those cases of asthma will be related or can be attributed to a specific pollutant. So this kind of extra level of interpretation will not provide by the tool, but give us a sense of where all these three important indicators, the environment, health, and the socioeconomic factors, are overlapping in the state of Colorado. So will give us a sense of highlight or put an attention of the geographical locations where this will happen.
Thanks, David. Ava, if that answered your question, great. If you would like to ask a follow-on question, if you still have something else that's on your mind, feel free to unmute yourself or ask again in the chat.
And Josie, while Eva is doing that, Eva, it's nice to see a former colleague here, by the way. I'll just add that there is something that I think we'll get your feedback on, and a factor we're balancing is that the more comprehensive our coverage, the more indicators we build into the tool, the less overall weight any one factor has. So we want to strike the right balance that has a wide range of inputs to achieve cumulative impacts, while also really not getting to a point where each individual indicator has a very low weight. So that's something we're considering as well.
And probably something to mention is that what we want is to have different exposure, not have similar exposure with similar indicators. In other terms, like one value of a specific air pollutant and different sources with the same air pollutant with different definitions. So try to select one single definition and then be able to, or allowed other exposures definitions included in the tool. Someone also asked in the chat if they have the opportunity to contribute with data. So if you have any specific data that you consider that will be relevant for us to include, don't hesitate to share that data with us. And we will be providing an email address where you can send us or recommend us the data that you think will be more important. And if you have even access to those data,
Oh, David, you froze for the last couple of sentences.
Sorry, I was mentioning if you have interest in a specific data, you want to share that data, you can share the specific data source or where you find or you think that this data is located. You can also share with us the definition of the data, and we can have a look of if we can find the original source of these data sources.
Thanks, David.
And David, I'll quickly answer. I think that was answering the question from Danny Flowers, that for any imminent ongoing health hazards, something that is not sort of long-term data set, but something like noise or ongoing pollution that you believe poses an imminent risk to your community, CDPHE does have an emergency hotline that can be reported to. I will admit, unfortunately, the website is down right now, but I'll just put that link in the chat. That is probably the best place to report that type of imminent concern, or obviously to the appropriate authorities if you think it warrants sort of emergency or 911. This tool is not for that type of imminent health risk.
Thanks for the clarification, Joel. Jen, can you guide us to the next question?
We have a question from Laura asking if race and ethnicity data or other population demographic information will be included in the tool.
So Joel, I know we addressed this question earlier today, and the answer is yes, but if you may wish to speak more specifically to that regarding the bill and those requirements, that would be great.
Yes, so the Environmental Justice Act, House Bill 21-1266, does require us to consider race among 3 demographic factors that will be included in the map. Those are race, which is any household that has any person who identifies as a person of color, low-income communities and households, and housing cost-burdened households. So those are 3 of the demographic factors that will be included. And there will be several other demographic factors, and we'll be asking for your feedback later on some of the other demographic factors we should consider. And Jen, I think we may have actually skipped a question from Velma Campbell about drinking water and recreational water pollution. The answer is that's another question we'll be asking you all about later. We're certainly considering various metrics of drinking water and surface water pollution, and we'd really like to get your feedback from the public on which of those indicators for environmental effects are the most important for us to consider. So just wanted to make sure we didn't skip that question.
Thank you, Joel.
A question from Javon regarding who we can contact regarding potential trainings on using the tool, and who can we reach out to regarding providing a concentrated group to participate in the beta stage.
Great, thanks, Jen. And I think I can take this one. So one of the most important things is to sign up for the mailing list. Now, given that you have already received some communication from us, we will likely be reaching out to you again. And we are aware that this tool will require not only the beta testing, but additional training for users. And we are still looking at how we will set up programming, particularly once we launch V1, in order to do that and to help people understand the functionality as well as the limitations of the tool. So Javon, make sure that you, and this goes for anyone on the call, that you're signed up for the mailing list. We'll be posting the website information, and we'll try to stay in contact with you, as well as you're more than welcome to help stay in contact with us.
The question about how the map will be updated in the future and how often.
Joel, I think that one might be for you.
Absolutely. So we are intentionally designing the tool using the R-Shiny platform, which will make it easy to upgrade frequently. So our team, including Margaret Horton and others that you met at the beginning of the call, will be involved with making updates on a periodic basis. We haven't determined how frequently we will make those updates. Of course, many of our data sets evolve over time. And one of the advantages of the tool is using up-to-date information, but I anticipate it will be at least once per year. And that's something that CDPHE will evaluate over time. We want to make sure we're using as up-to-date information as possible with some of our evolving data sets, especially on demographic information, as well as air pollution, which is reported on an annual basis and does change over time.
Thank you, Joel. And let's do a few more questions, and then I would like to get us into our questionnaire, as I think it will actually begin to address at least some of the questions that I'm seeing in the chat as well. But Jen, if you could pick maybe 3 or 4 more questions for us to answer now, and then we'll have additional Q&A time at the end as well. So if we don't get to your question right now, we hope that you can stay on the line, and we will try to answer all of the questions.
Sure. From Ashley, she's asking how will areas be flagged as disproportionately impacted communities per the Environmental Justice Act, or will all areas identified by the tool be considered DI communities? And will the information and overlap be used to prioritize or rank the communities?
I'm happy to answer that, Josie and Jen. So the answer is that the Environmental Justice Act has a 3-pronged definition of a disproportionately impacted community. One is communities that fall under one of the 3 demographic factors I mentioned earlier, which are race, income, and housing cost burden. those meet the definition of the Act. We have tools available like the Climate Equity Data Viewer on CDPHE's website that display them. This tool will be used to identify communities that meet another prong of the definition, which is communities where there are cumulative impacts of multiple environmental exposures that lead to persistent health disparities. So we will be using the tool to prioritize and rank communities. We haven't identified sort of what percentile threshold will make something fall within the definition, but that is certainly something that the tool will be used for. And I apologize for my barking dog in the background. And then finally, I will just kind of try to answer a second question from Velma Campbell that gets at the third prong of the definition, which is areas that have a history of environmental racism that is perpetuated through exclusionary policies like redlining. So we're undergoing a separate process to identify where those communities are and working with a panel of historians that will be convening early next year to get input on that. And our hope is that in later iterations of the tool, we will overlay that data into EnviroScreen so that that information is available as part of the definition of disproportionately impacted communities.
Thank you, Joel. Jen,
Renee is asking if data will also show impacts by sector, such as extractive industries, transportation, agricultural industries, and others.
Until now, other tools that exist in other states do not provide that by sector specific analysis. So probably what you will see is a combination of multiple sources and not a sector specific. But if you believe that that will be very helpful for your work, during these engagement activities, we want to learn how are you will using this tool and how this tool will help you to do your work and to improve environmental health in Colorado. So probably at this first version of the tool, this section of the subsection of a sector will be not possible, but that was something that we can consider for future iterations of the tool. So now we'll have different sources. Again, what you will see at in the map is one single score. Probably there's an additional opportunity to actually see single layers, but that will be not tagged by a specific industry.
One more, Josie.
Yeah.
And so, David, you just referenced the other tools. Asmal is wondering if we're following any specific state to develop this tool.
I think each of the individual tools from the other states are very different. Even they have a similar purpose. The level of the number of indicators and the type of indicators they include are not exactly the same. So the California EnviroScreen tool is the one that have the most type of layers, but there are layers, or I will say information that probably will be very specific for California, or information that we don't have in other states. Again, in Colorado, probably we have other information that California do not have, and that will be possible to include in this tool. So we use all the tools as a reference, and we want to take advantage of those experiences, but we are developing something very specific for Colorado that actually allowed us to take advantage of the information that is available locally.
Great, thank you, David. And while we would like to ask a few questions to all of you through a brief questionnaire that we have. It's available both in English and in Spanish, and we will post those questions in the chat. And while you all are working to complete the questionnaire, I would like to ask our team to respond to some of the questions in the chat that have not been responded to yet. So thank you for posting those. You should be able to find them. If anyone has any challenge accessing the poll, please let us know. There's about 8 questions for you around helping us to identify specific qualities or characteristics or functionality around the tool. And again, we will have some additional time at the end, as well as try to answer your questions now while you're answering our questions. So let's take about 5 or 7 minutes now to go ahead and do that. So we'll reconvene at about 50 minutes past the hour. That gives us about six or 7 minutes to respond to the questionnaire, and then we'll go from there. Recording. Okay, so let's go ahead and look at the polling results. If you haven't quite finished yet, that's okay. Feel free to continue responding as we look at the results briefly, and then we have some follow-up questions and can continue to revisit any of the questions that that we've been working to answer in the chat as well. So we are scheduled until 7:30 this evening and are happy to stay on as long as there's interest and respond to any thoughts, questions, comments, concerns that any of you may have. Okay, so here are our responses in Spanish on the left, English on the right. And I will move through these sort of in parallel. It looks like most of you intend to use the tool. Maybe a few of you aren't sure. I'm not going to go through the results specifically for each one, but to take a moment to let you see the results yourself. Hopefully it's big enough that you can all read what's here. All right, so first I will see if there are any questions from our design team, David or Dan, Joel, anyone really from the team. If you have any questions that you would like to clarify based on the polling results, and I'm happy to also move us back and forth through those.
Josie, I don't have any clarifying questions right now, but obviously we'll look really carefully at these results, and we really appreciate you all for sharing them. There are some answers that really jump out at me. The clear focus on using the tool to design policies or public health interventions that can address the disparities. That was a clear majority response. There was also a clear majority response indicating that drinking water was a priority indicator for us to consider. And it's really helpful for us to get that input so that we know where to focus in developing the tool. And we will absolutely take that to heart in the development.
Thank you, Joel. David, any questions for you at this point or comments?
No, not about the results. Yeah, thank you. But I will take advantage and mention something about the questions in the chat, that the results of the tool will be able to download the results. So probably in the table or even the map, you will be able to download this kind of information.
And I think it would be a good time to both take a moment to talk about what next steps look like. And then I would like to take the remaining half an hour after that to both verbalize some of the key questions that were in the chat, as well as talk about any of the additional questions that are showing up. So for those that have limited time this evening, I'd like to share a little bit more about next steps. And then for those who are interested and available, I would like to take a little bit of time with the questions that we've put into the chat, as well as open the conversation to others. So thanks again for taking your time to help complete the questionnaire. Again, we're really seeking to make this tool be user informed. And while everything that we all hope to do may not be possible, we want to understand what the aspirations are, and we'll work diligently to incorporate the input and perspectives that you all are giving us so that we can make this the most useful and valuable resource that it can be for you in your work, in your communities, and really to meet the purpose of the tool. I think someone asked earlier how we might stay connected. Let me go ahead and share my screen. So you can stay connected. As Joel mentioned, the website is getting updated, but we do have a website here at cdphg.colorado.gov/EnviroScreen. So we will continue to make updates, as I mentioned, and I'll talk about this in a moment. The beta testing will probably be, 6 or 8 months from now. So we are going to go into an intensive period of development, but stay in touch while we're doing that. You can, if you're so inclined, give us your email and sign up for the mailing list, and we can provide periodic updates about upcoming information, posting to, we'll be posting to social media as well. Thanks, Renee, for your information there. We also have a Facebook page. Joel, you may be able to place that in the chat. I didn't think to grab that link before this meeting. So if we can maybe plug that. And Joel is open and available to anyone and everyone's input and conversations, and Joel's contact information is located here. We will be making this recording, as well as the slides and all of the content, available in a public folder, and you all will receive a link to that folder. So again, it will have this recording, the presentation that we've shared, as well as some additional background documents and information. And that should be included in the follow-up email that we will be providing. Also, there's a lot happening in the chat, but Margaret has provided an opportunity for you to put your name and email down for interest. And then Joel's provided the Facebook page as well. Also, for those of you, if participating in today's call falls outside of your regular job responsibilities, we do encourage you to sign up to receive a $45 Visa gift card. If you joined through the Zoom link, please send a private email or chat to Joel, either in this Zoom meeting or after the meeting. That's also true about any of the follow-up information. If you did not register for this event, but followed a link through Facebook or otherwise, we don't know who you are. And so we can't send the follow-up information. So if you're able to send us your contact information, we would be more than happy to share with you the link for the participation incentive, as well as for additional follow-up information. So please make sure that we know how to get a hold of you in the coming weeks and months, particularly if you would like us to follow up with a participation incentive or with a link to the public folder. That would be great. And I think that is all for sort of the formal presentation as well as the questionnaire. And as mentioned, I would like to go back to some of the questions in the chat. Joel, I might invite you to choose some of the ones that you feel like you might like to vocalize, or that might be better if you could say something about them, as well as feel free to continue asking questions in the chat.
Sure, I'll just go ahead and try to do a quick round robin of some of the questions I think we didn't answer. I think we did manage to answer the rest of them in the chat. So I think the first one we haven't answered yet was from Renee about whether training programs will be accessible in languages other than English for disproportionately impacted communities, and how we will be conducting outreach to frontline communities. The answer is yes, we are committed to language justice at CDPHE, and particularly in everything the Environmental Justice Unit does. I'm pleased to announce we're in the process of actually interviewing a full-time translation and interpretation specialist who will be able to make sure that everything we do is accessible in both English and Spanish. And we are very open through the CDPHE Language Services Program and providing information in other languages besides English and Spanish on request. And we absolutely do want to make those trainings as accessible as possible to residents of disproportionately impacted communities who we hope are going to be using the tool to learn more about the environmental health risks in their communities. And we're open to ideas about how best to do that. Please send those ideas my way, but certainly things like this, having meetings in the evening, compensating participants for their time, providing real-time interpretation, and then when possible, really going out to communities and meeting folks where they're at to conduct the outreach in person when that is safe in terms of COVID. We are very open to doing that, but again, would welcome feedback on how we can better conduct that outreach. I think the next question that hasn't been answered is about noise pollution. At this time, we are not planning to include noise pollution as a input in the tool, which reflects that we aren't aware of any data sets that would provide that information statewide. But again, we're open to feedback. So if you are aware of that information, please send it our way. We're very interested in learning about it, and any data that's available, we would certainly consider trying to find a way to build into the tool and weighing it among other exposures. We recognize that noise does impact people's health. And then I think the next question that we haven't answered pertains to PFAS and why PFAS was thought of as sort of, it may have been categorized outside of water quality in the questionnaire. So we are certainly considering PFAS, and I don't know if Christy or Margaret would like to take a quick moment to sort of discuss CDPHE's efforts to map sources of PFAS contamination, which I think can impact both water and soil, or anything else there that either of you would like to add, and how we're thinking about building in that data. Okay, I'm not hearing anything now. I think Margaret's in the Spanish channel, so and I think is recording there, so she might not be able to easily leave it to respond to what I just said in English. But I'll just say that that is something we're looking at, and I would guess that our kind of recognition that PFAS contamination can come through potentially multiple media, but particularly through water is why we didn't classify that in drinking water. And I don't think there are any other questions we haven't answered yet. Oh, Kate, we haven't specifically set up any outreach or information sessions specifically for LPHAs, local public health agencies or local governments, but I think that's a good reminder. I think maybe when we get to the point of sort of beta testing the tool and really diving in on the draft tool as it's developed, we could do that. And I think if there's a strong desire for having additional outreach before we have a draft tool to developed, we could potentially set that up for local public health agencies or local governments, and would welcome other feedback from local governments to reach out to us if that's something that's of interest. But certainly we can keep that in mind for the beta testing stage to have sort of a special tool for that. Let's see. So, and then I think Ashley has a question about determining indicators used for cumulative impacts on the second prong of the disproportionately impacted communities definition. We are, yes, consulting experts. You are the experts, right? We do want to hear from communities about their lived experience and the things that are important to them. So our public outreach session is to learn what factors we should build into EnviroScreen for cumulative impacts is one way that we're consulting with experts. I would also highlight the expertise of David and Dan and the whole team of developers at CDPHE, or sorry, at CSU, who are working on developing the tool. And David, I don't know if you want to say anything more sort of about your background and sort of how you and the rest of the CSU team are bringing your expertise to bear on the tool.
Yeah, sure. So as I mentioned before, I'm professor of environmental epidemiology, and I have been working in environmental risk factors and health by several years already in several locations. I have been working also with different stakeholders and in different tools to actually try to bring the exposure assessment, the risk assessment part to the translation to the policy and action. So we are screening different health outcomes based on the burden of disease in Colorado. So what diseases are the more relevant, which ones are producing more cases of disease, but also disability, premature mortality. We are also identifying those risk factors that have more epidemiological evidence, more robustness that relates the risk factor and health outcome. So, and also based on the evidence, this is not enough to have one single study that suggests that there is a risk. We have also analyzing if there is any other studies or meta-analysis that provide us a certainty that this is well known as a risk factor. In those cases that we don't have a lot of evidence, we have also collected information in these engagement activities to understand the risk perception in the community, to introduce that vision in the process. So there are different layers of selecting those risk factors and health outcomes in this analysis. And very important, many of the information and science evolves rapidly. So the idea to include new indicators will make this tool sustainable in the future and make it valid for different purposes. So if you find out that the tool is missing something, don't hesitate to tell us and send us share that information with us. Probably you will see that the tool will not include everything, and mostly because data, lack of data is one of the main limitations of these tools. So, and even if we have data in a specific location inside of the state, if this data of this information is not available for the whole state, probably that will not be used in this tool, because the idea is to map the whole state. So we have specific information about cities or rural areas, but not the other way around. So probably will be biased the final interpretation of the tool. So that's the reason we are selecting those statewide type of data sources. And something additional that I wanted to clarify, that the purpose of this tool is to be the first place that you can go and identify if there are issues geographically in your community. but this tool should not be used as the final decision to take changes or specific actions. These need to be complemented. These kind of tools are very helpful, but they also have a lot of limitations.
Thank you, David. Joel, I know that earlier you were typing a lot of responses, and I was wondering if you wanted to look back through the typed responses and see if there was anything else that you wanted to verbalize. Those were pretty quick replies.
That would be great, Josie. I'll go ahead and do that, and also open it up for all of the rest of us who responded, or we certainly welcome follow-up questions in whatever format. Again, I think you have the link to our feedback form. We've put that in multiple places, but if you do have other ideas, you can email me directly or use the feedback form. Either way, we will get information to the team about other indicators we can include. I hope if there's one thing you take away from tonight, it's that we're listening and we're really open to ideas from all of you about how we can really best shape this tool to make it useful for the folks who are going to be using it. And then I think Renee's question about Cultivando's monitors and whether those would be included, we've heard really loud and clear through the interviews and focus groups and now tonight, I think that interest in including real-time air monitoring data in the map. I think it's hard for us to, as David was saying, really synthesize that with information about kind of long-term health risks, because that information about air quality is changing over time. But I think we're really open to exploring ways of putting sort of a clickable link so that you can get to that real-time air monitoring data that is provided either by Cultivando, by entities that are regulated under House Bill 21-1189, the 4 covered facilities that will have to have Pennsylvania air monitoring networks in place, as well as potentially CDPHE's air monitoring data or other community air monitoring efforts. I think that's something we'd really love to explore in version 2 of the tool, or perhaps in the first version, of just how we could kind of get some easy ways to link to learn about current real-time air quality data in folks' communities, even if we can't build that necessarily into the long-term score, which will have to sort of remain fixed at least until we update each year. And we are of course open to including that community monitoring that is done by organizations like Cultivando, in addition to links to the monitoring that is done by CDPHE, or even monitoring that is done by an industrial organization. Let's see, Lauren, did you want to say anything else about sort of the uses of the tool by the Air Pollution Control Division or other state agencies?
Yeah, I think it was Bill Oberman from Denver who had that question. Thanks, Joel. And I think he's dropped off, but for others, there are several boards and commissions and agencies who now have requirements to identify and consider disproportionately impacted communities and their programs and decisions and rulemakings. And so the question was, would this tool become kind of the mechanism for doing that? And the answer is yes, once it's ready. And so in the meantime, the Climate Equity Data Viewer does have the capability of kind of getting at that preliminary definition that Joel was mentioning earlier for use before in rulemakings before the Air Quality Control Commission, for example.
We got a new question in the chat regarding the differences between urban and rural and how we plan to account for the very different types of exposures and risk experienced in those areas.
So I will say that we will intend to understand what type of exposure exists. As an example, in urban areas, we have parks, open spaces, green spaces that probably when you translate that to the rural area, you have tons of there in some locations. So, or trees, etc. So we want to use some definition of data that actually can be captured equally across the state. So provide us a proxy of that specific reference that the community is referring to as a park, green space, or vegetation, to be able to compare geographically the distribution of those. As other case is pesticides. So if pesticides probably are more common in the rural areas and less common in urban areas. So unfortunately, there is not actually a database that tells us what is the concentration of these pesticides in the environment, but we know that there is data in terms of the market that is related to the pesticides by specific geographical locations. We can use that as a specific proxy for the exposure. So depending of what are the exposure, we need to look for statewide data that help us to compare different geographical locations, including urban or rural. Something that we are avoiding to do is just having a specific exposure for urban settings or a specific exposure to rural settings, because when we compare the different parts of the state, we'll be producing not a clear interpretation of what the score is representing. So we are trying to identify those exposure indicators that can be represented in the urban and rural areas equally. So I just want to clarify that the tool, again, one of the purposes of the tool will be the door to open to this visual and geographical distribution of the risk, health outcomes, and socioeconomic factors. And probably, as Joel mentioned, will not include many real-time data, but we hope to be also a source for those pathways or links where you can actually access to the real-time data in other resources that already exist across the state. So this tool probably will not include everything, but it will help you to actually arrive to those places where this information already exists.
Thank you, David. It looks like there's also another question in the chat about using existing data versus real-time data from various communities, and maybe even how those two things relate to each other.
So we are using data that already exists. So the data probably from the past years. So, but as I mentioned before, if you have a specific data that you want to share, but this data, for some reason, due to the geographical distribution, or because it's a real or short-term exposure data, probably what we can do is help those users to identify this specific data source and provide the links to bring you to your source. So this tool should be complemented by other tools and should be not the final tool to take decisions in regard to different actions, and give us the idea to where we need to put more attention and where we need to have more resources to understand better what is happening locally. So the complementation with other sources or tools or information will be very important in this process of creating this tool.
And I would just add to that, David, that we recognize the strong desire for real-time information about sort of current things that are affecting people's health, and we don't want to, sort of minimize that concern. It's just that that's sort of beyond the functionalities and intended purpose of this tool. I will say though that we will certainly have more up-to-date information in EnviroScreen than is available right now through other tools like EPA's EJ-Screen. So for example, the air data in EJ-Screen ends up being several years out of date in many cases because of sort of the way that it's collected and reported and the frequency of the update. So in some cases that data comes back from as late as 2014 in the current version, whereas we'll be able to sort of have something like an annual update that reflects the sort of annual updates on air pollution data that we receive at CDPHE through the APEN reporting system. And that is not perfect, but it's better. And we recognize we won't be able to sort of be perfect in that response, but what our goal is in making this tool is really making sure that we're reflecting what is the reality and the lived experiences of communities across Colorado that is more up to date and accurate for their lives, even if we aren't able to get that minute by minute data. I also, in terms of sort of the typed answers that we're clarifying, while we have a moment, I put a link in the chat in sort of the response, the question about focusing on Globeville, and As many of you know, CDPHE is really committed to our efforts to advance environmental justice across Colorado, and we are especially focusing our efforts in the Globeville, Elyria, and Swansea neighborhoods of North Denver, as well as Commerce City, which is a unified area geographically in many ways, and of course, an area that has multiple sources of air, water, and soil pollution from many different sources, in a population that is predominantly low income and Latino, and thus does present a clear environmental justice issue that we want to seek to address and try to reduce some of the environmental health disparities in that community through our policies. We have created a dedicated website for the Commerce City, North Denver area that I linked in the chat earlier. I apologize that our CDPHE website is down during this meeting. I'm sure it will be back up soon. And I did want to note that just because we're starting to focus on Globeville, Elyria, Swansea, and the Commerce City area doesn't mean we're not focusing on other parts of the state. And as our environmental justice unit, the team that Natalie and I are a part of grows, we'd like to expand those concentrated efforts in other areas of the state that we identify through EnviroScreen or other processes, and we are starting to concentrate more of our environmental justice efforts, in particular in Pueblo. So I do want to acknowledge and recognize that question and recognize sort of the history and the work that we're trying to do to remedy some of the disparities that we do know exist throughout the state.
Thank you, Joel. And there's another question about the CDOT funded air pollution studies. Is that something that either of you are familiar with?
I can start to answer, though I'm not particularly familiar. I believe that CDOT has I think, coordinated with a variety of stakeholders to install an air monitoring network along I-270 as part of their investigation of potential changes to that highway. I'm not sure that we would be incorporating that data into this tool, but I think like other real-time data, we could. I'm not actually sure if that monitoring network is permanent. CDOT has also, through a settlement that I should acknowledge prior to CDPHE, I was the attorney who negotiated it on behalf of community groups in Globeville, Elyria, Swansea. Through that settlement challenging the Central 70 project, CDOT did also fund for PM10 sort of coarse particulate matter, such dust monitors along the Central 70 construction route. I don't think we would likely incorporate the data from those monitors into this tool just because they'll be nearing the end of their life cycle by the time EnviroScreen is live as that construction project ends. So the answer is I don't think so, but if anyone has ideas about again, monitoring networks we should be thinking about, or really any sources of data, we're very open to it. And of course, we do want to make sure that we are providing as much information as possible using the resources that the state government has already dedicated to environmental justice and other environmental efforts, and using that effectively and efficiently in this tool. So sorry if that didn't directly answer the question, but may not have a sufficient context to answer it.
I want to also answer one question that I put on the chat, but I want to verbalize that answer. In terms of the specific interaction between a single pollutant and a single outcome, so the tool will not provide this analysis and interaction between single pollutant and outcome. The idea of the tool will be a geographical overlap of health outcomes and risk factors, including these environmental risk factors. For those that are more familiar with methodological approaches, this is more like an ecological analysis. So it's just overlapping geographical locations, different exposures and health outcomes. We will not do the analysis between the specific interaction of a specific or single exposure or single health outcomes.
Thank you for the clarification, David. Well, if there aren't any additional questions, I think we can wrap up for the evening. And I know that I speak for the entire team when I say thank you so much for spending your evening with us. Your input and your insight and your questions are incredibly valuable to us. And we are working diligently to both hear and understand the concerns, questions, opportunities everything that others are seeing as we go about developing the tool. We look forward to being in touch with you all over the coming months and years to come. Please do provide your contact information. There were a couple of different ways that people were able to access this meeting. So many of you signed up through the event link. Others of you joined directly. Particularly if you joined directly, please do send your contact information to Joel so that we can properly respond with a follow-up email. Joel, maybe you could put your contact information in the chat one more time. We will be following up in the morning with a link to the survey, to the public meeting information, as well as a link to the form that you can complete for the participation incentive. Lindsay, if we can go ahead and put that in the chat as well. Now would be a great time to do that. Thank you so much, Lindsay, for that. Also, thank you, Lynette, for your translation services this evening. We appreciate you, the work you do and the work that you did for us this evening to help provide language justice. Any other closing comments as we round out our time together this evening? All right, thank you so much.
Thank you all for your participation and feedback this evening. Goodbye.